Many muscles of the chest, back, and abdomen can easily be seen using anatomical models. The large chest muscle is the pectoralis major. On this side of the model, the pectoralis major has been removed so that you can see the deep pectoralis minor. The pectoralis minor is attached to both the scapula and the ribs, and so both of these structures can move. If the ribs are fixed, this helps pull the scapula down and toward the chest cavity. If the scapula is fixed, this muscle helps pull the ribs upward. The pectoralis major originates on the sternum, the clavicle, the first 6 or 7 ribs, and on the aponeurosis of the external oblique muscle. It inserts on the humerus, on the greater tubercle of the humerus. When this muscle contracts, it's going to flex the upper arm at the shoulder and pull the arm across the body anteriorly, adducting the upper arm. From the side, you can see the serratus anterior. This gets its name from its serrated appearance. The serratus anterior is a prime mover to protract the scapula and hold it against the chest wall. There are 4 abdominal muscles: the rectus abdominis, the external oblique, the internal oblique, and the transversus abdominis. These muscles get their name from the directions their fibers run. So the rectus is straight, the obliques are diagonal, and the transversus runs across. It's hard to appreciate these muscles on a hard plastic model. It might be better to see them on a dissected specimen. So this is a dissected cat. The rectus abdominis, the external obliques, the internal obliques, and the transversus. Now all of these muscles are held in place by aponeuroses which have been removed so the edges of the muscles are free. You will notice the rectus abdominis has fibers that go straight up and down, and the external oblique has fibers that run diagonally. They run downward from lateral to medial. This shows you that the external oblique can be peeled back, revealing the entire internal oblique. Notice how the aponeurosis has been removed. These fibers do not go all the way across the abdomen, but the aponeurosis will attach here at the linea alba. The internal oblique fibers run diagonally upward from lateral to medial. Both the external oblique and the internal obliques have been peeled back in this specimen to show you the transversus abdominis. Notice how those fibers run straight across the body. Again, you can see the fibers do not extend all the way to the midline, but are in that aponeurosis which will extend to the midline. Going back to the model, you can see the aponeurosis here sort of masks some of the fiber direction. But on this side, the aponeurosis has been removed so that you can see the rectus abdominis and those straight vertical fibers. The external obliques are here on the side. This is their aponeurosis that covers the rectus abdominis. And you can see how these fibers go downward from lateral to medial. On this side, both the aponeurosis and the external oblique muscle have been removed to show you the internal obliques. Notice how those fibers are going diagonally upward from lateral to medial. These obliques can be easy to confuse, particularly on a model like this, so you need to pay attention to the fiber directions. There's a couple of ways to remember this. If you slip your hands into your pockets, your fingers will be pointing in the same direction as the external obliques. If you cross your arms, your fingers will be pointing in the same direction as the internal obliques. If that doesn't work for you, maybe you can remember that the external obliques, when you have both of them in place, make a downward pointing V, make an arrow downward. And perhaps you can remember down and out, that the fibers that make the downward V are the outer or external oblique fibers. To see the transversus abdominis, you've got to remove the front of the model and flip it over. This means you're looking at the inside of the abdominal wall. And here you can see those transverse fibers running across the abdomen. Right here, this is the rectus abdominis coming through the aponeurosis wall. The rectus abdominis originates on the pubic crest and the pubic symphysis and inserts on the xiphoid process and the last few ribs, the 5, 6, and 7 rib. When this muscle contracts, it's going to flex the spine. You will bend at the waist. The external and internal obliques will help you rotate the spine. So this is your twisting movement. And with the fiber directions, the rectus going straight, the external and the internal obliques crossing each other, and then the transversus going this way, you have a strong network of fibers. All four muscles act to compress the abdominal contents. This muscle wall is all that keeps the abdominal contents held in their appropriate places. As we move to the back, you will notice a large kite-shaped muscle. That's been removed on this side, so you have to imagine this side. This is the trapezius. The trapezius will help extend the neck, pulling the head back, and will also elevate and lower the scapula. The other large muscle on the back is the latissimus dorsi. It gets its name because it's on the side, lateral, and on the back, dorsal, latissimus dorsi. The latissimus dorsi has an aponeurosis that attaches it to a number of structures on the back. It is attached to the vertebral spines of the last 6 thoracic vertebra and all 5 lumbar vertebra through this lumbosacral fascia. It's attached to the last 3 or 4 ribs, and you can see it's attached here to the iliac crest. These are all of its origins. It inserts on the humerus in the space between the greater and lesser tubercle. When this muscle contracts, it's going to pull the arm backwards, so it will extend the upper arm at the shoulder and will also pull the arm across the back, so it adducts the arm posteriorly. On this side, with the trapezius and part of the latissimus dorsi removed, you can see some of the deeper muscles. The levator scapulae is named for what it does. It elevates the scapula. It also helps adduct the scapula. Then you have the rhomboid minor and the rhomboid major. These two muscles are usually referred to together as the rhomboids. They get their name from their shape. A rhomboid is sort of a pushed over square, so you can see this is kind of squarish and pushed over. These also elevate and adduct the scapula, but they play a role in stabilizing the scapula. There are some muscles you may have seen on other models, but we'll point them out here. The deltoid, the large shoulder muscle, the gluteus maximus, the real fleshy muscle of the hip, and the gluteus medius. And on this side, you can see 2 of the rotator cuff muscles, the supraspinatus and the infraspinatus.